how does this diabetes affect your body? On your body. This diabetes, as I said, raised glucose levels. This high glucose levels in your blood is toxic to your body. As I said earlier, every organism loves much food, and if your blood is having very large quantities of food that your cells love, and these food will also be a food for even bacteria or even other microorganisms. So your body may be a habituant for these microorganisms, and so you will be suffering from different infections. And so the people with diabetes mellitus may be suffering from infections of the urinary tract or urinary tract infections mostly. And these urinary tract infections, you will be having burning urination. I mean, you will get pain while you start urinating. And you will be having fever with chills. In Telugu, we call this as chali jwaram. And not only these urinary tract infections, many infections tend to increase in cases of diabetes. And this glucose, as I said, is toxic to your body. This will lead to increased production of reactive oxygen species. These reactive oxygen species are like defensive mechanisms that your body will produce against foreign bacteria or foreign substances that enter your body. And this reactive oxygen species is not only damaging the foreign bacteria that enters your body, but will also damage your body surrounding that area. So in this diabetes patients, these reactive oxygen species are produced more, and this increased ROS will cause damage to your body, and this will affect many organ systems in your body, and most commonly blood vessels. These blood vessels, when they get damaged, they have intrinsic property. When there is a damaged area, that damaged area is bridged with clot. And when these blood vessels get damaged, there is an intrinsic property of clot formation. This clot will bridge the gap in areas where these blood vessels are damaged. So, in this situation, when your blood vessel gets damaged because of that reactive oxygen species, there will be a clot formation within your blood vessels. And this clot formation, if this occurs in any important organs, this will eventually block the blood supply to that organ, and that organ will die without its blood supply. For example, if this clot forms in your blood vessels of your brain, then this can cause stroke. And if this clot forms in your vessels of your spleen, then your spleen gets damaged due to this lack of blood supply. And if this occurs in your heart, this can lead to heart attack. And if this occurs in your kidney, then this can cause necrosis of your kidney, or simply where your kidney gets damaged. And not only this, it is even toxic to your nervous system. That means nerves. So these nerves get damaged, and so in diabetes patients they will be having neuropathy. Neuropathy, this can be there can be abnormal sensations, like pins pricking or like something itching over some area, and sometimes they may not feel any sensation over some area. Most commonly, this can be seen near feet or foot. So, these patients, if they got any injury over their feet, they will not sense the pain, and so there will be a tendency that they will not notice the injury and they will walk over that area, over that injured limb, and so this injury will gradually increase in size. And also in these diabetes individuals, as I said, this high glucose is toxic to your cells. Your body's healing capacity is also deranged, and so when there is an injury, these high glucose levels will make your cells do not heal. And for any cell to heal, or it requires energy, and that energy it derives it from glucose. So in diabetes, this glucose utilizing capacity of this cell is deranged, and so even there is high amounts of glucose in the body, the cell cannot utilize it. In this way, the cycle continues. So this high glucose is toxic to the cell, and also this high glucose, the cell cannot utilize that glucose, and so your healing capacity will derange, and so any injury that a diabetes patient will have does not heal for a long time. Also, it will affect your bladder as well. Your bladder, urinary bladder, it stores your urine until you urinate, right? In this neuropathy, your bladder loses its capacity to retain the large amount of urine, and so whenever your bladder gets small amount of urine, these people tend to urinate, and so in diabetes, these people will have increased frequency of urination. And this urine has high amounts of glucose because your blood has more amounts of glucose, and that glucose is excreted out through your kidney into the urine. And as this urine has high amounts of glucose, it passes through your excretory system and it passes through your urethra and gets out. So this high amount of glucose in the urine forms a medium for growth of microorganisms or bacteria within your urethra or in your urinary tract, and this will indirectly lead to urinary tract infection. And also your neuropathy will lead to sexual dysfunction, as your nerves should be intact for you to perform sexual intercourse, and also your nerves should be intact for you to attain pleasure and also for your penis to be erect. And when these nerves are damaged in diabetes patients, they will be suffering from impotency and loss of desire for sexual intercourse. Now this is called as loss of libido, impotency, loss of libido, and this diabetes mellitus, as I had said, this will damage your blood vessels, and these blood vessels are present in all organs of your body. So these blood vessels can be small blood vessels or capillaries, or somewhat medium-sized vessels or very large vessels. So this, most commonly, these capillaries gets easily damaged, and when these capillaries gets damaged, the organs in which these capillaries are present also gets affected. So some of these examples are your eye. So suppose this is in the eye. Well, not a good artist, I said. Right? And this is your eye. This gets damaged. And your kidney. Your eyes, your kidneys, your heart, and whatnot, your brain, and there are many other organs that gets affected because of this diabetes mellitus. And if this diabetes mellitus, if the individual also smokes, then this everything gets attenuated. There will be more damage to your body. Now that you know how diabetes will affect your body, let's see how do we prevent this. Well, prevention. Many of you already know that diabetes can be hereditary. That means if your father or your mother has diabetes, then you may be having chance of getting it in your future. So in these kinds of individuals, all we can do is primary prevention. So this primary prevention is nothing but practicing good lifestyle. And good dietary habits. So what is good lifestyle? It's nothing but exercising daily, at least 30 minutes, and knowing your daily calorie requirement and following strictly it, and consuming low fat diets, and having regular health checkups, and maintaining your body weight according to your height and age. But once you already got diabetes, then you can prevent the major organ damages that can occur later by following secondary prevention methods. Secondary prevention also contains the same things that are present in your primary prevention, but in addition there are certain drugs or medicines that your doctor may prescribe to you so that your fat levels, bad cholesterol levels will remain low. For example, one of those drugs are statins that your doctor might prescribe so that your bad cholesterol levels will be low. And now you know about the prevention of diabetes. And so how do we treat this? Well, in treating diabetes mellitus, as I said, there are two situations in which in one thing the insulin will be normal, in another thing the insulin is low. So in individuals who have got low amounts of insulin, your doctor may prescribe you doses of insulin. And you need to take this insulin as injections. And in individuals who are having normal levels of insulin in their body, then this might be due to insulin resistance or decreased insulin sensitivity of your body. In this situation, your doctor may try different combinations of medicines, and these are usually called as anti-glycemic drugs. And one of those drugs are metformin. This metformin will usually have a metallic taste when you take it. But that's okay, you can use it. And your doctor will provide you the doses and the duration and also how to take this drug. And along with it, your doctor may prescribe other drugs. And sometimes your doctor may prescribe even insulin in these individuals. Not only these drugs, there are many other drugs that your doctor might prescribe you based on your clinical outcome. Well, now that we came to an end, the take-home message of this video is diabetes occurs due to your abnormality in your glucose utilization of your body. And this glucose utilization requires insulin in some individuals, and in some individuals there are other drugs that your doctor might prescribe. And these individuals must strictly follow the doctor's advice on taking these drugs. And all these individuals with their family history of diabetes in their father or mother or in their grandparents, they must get themselves checked after they cross their 40 years of age. And they should practice healthy lifestyle activities like exercising at least 5 times a week with at least 30 minutes per day, eating healthy food, low fat content food, and taking 5 small meals per day with 2-hour intervals. And these individuals who have no diabetes must be very careful when they are walking, and they must always wear microcellular rubber slippers or footwear. This will prevent their feet from getting any injuries, and they must always use spirit or Dettol or some anti-infectant or anti-infectant solution, and with the help of cotton they should clean their web spaces in your feet and also between the fingers of your hands. These are the web spaces present between these fingers, and these diabetes individuals must clean these web spaces with the help of Dettol or spirit over their hands and also on their feet. In this way, we can make sure that there is no insect organism lodging within your web spaces, so that if you got any injury, it might prevent any further superimposed infection. And also, these diabetes individuals must strictly avoid alcohol consumption and smoking, as this has got very high calorie content, and this may itself exacerbate your diabetes. And also, your smoking may perpetuate or attenuate your existing illness, and it may add as air to fire and leading to your organ damage. And get frequently checked for your blood glucose levels with your doctor. Or you can also buy automatic blood glucose level analyzers from the market that are already available, and you can get yourself checked at home. Well, if you face any side effects while using your drugs, then you must immediately report it to your doctor. And now that we have come to an end, let me tell you, or if you got any further questions, please let me know in the comments. I will definitely answer them for you. Thank you guys. Thanks for watching. This is Tarun Could Be Better signing off from your doctor next door. See you again in my next video. Till then, good day everyone. Thank you guys. And please subscribe and share and spread the knowledge for everyone.